Your clinical staff spent years training to treat patients. Right now, though, they are likely spending a massive portion of their day battling intake paperwork, prior authorization packets, and referral forms. According to 2024 AMA data, physicians lose an average of 7.3 hours every week to administrative tasks. For non-physician staff, the burden is even heavier, collectively spending more than 15 hours a week strictly on documentation. This means nurses and medical assistants are being actively pulled away from patient-facing, revenue-generating work to cover the overflow at the front desk. When forms pile up, it slows down referrals, delays prior authorizations, and triggers claim denials. It directly attacks your bottom line and burns out your team. Treating form completion as a catch-all task for your clinical team cannibalizes the revenue of the practice and pushes your medical staff out the door. The problem extends directly to your frontline administrative staff. Practices attempt to hire their way out of the paperwork, leading straight into a staffing spiral. The MGMA documented a 40% annual turnover rate for front office support staff. Every time you cycle through this hiring loop, replacing a single staffer costs between $25,000 and $30,000 in recruiting, onboarding, and lost productivity. When one person quits, the remaining staff have to absorb their stack of incomplete forms. That extra workload accelerates their own burnout, ensuring they will be the next to leave. It is entirely understandable why 53% of medical group leaders named finding qualified candidates as their single biggest challenge in a recent MGMA poll. Trying to solve a structural paperwork issue with the traditional in-house hiring model traps you in an expensive loop where turnover inevitably breeds more turnover. Practice owners face a clear choice: keep fighting the uphill battle of in-house hiring or completely decouple form completion from the physical office. Most practices budget for the $35,000 base salary above the surface. Below the waterline, you pay for benefits, taxes, and turnover costs. Factoring in all overhead, the true loaded annual cost of a single in-house administrative staffer climbs to $60,800. You retain the ability to physically walk over to a desk and check on a form, but you remain entirely exposed to workflow gaps the moment someone calls in sick or quits. Those gaps are expensive. When form completion falls behind or goes out with errors, it triggers a 5 to 10% claim denial rate downstream. For a typical practice generating $3 million a year, documentation errors can erase over $150,000 in annual revenue. The in-house model offers the familiar comfort of shoulder tap management, but guarantees high operational costs and severe revenue risk. The alternative approach is outsourcing the entire form completion process to a dedicated virtual administrative team. Staffingly provides a dedicated form completion specialist specifically trained on healthcare documentation for a flat rate of $1,800 per month. Comparing options side by side, a $60,800 in-house burden against a $21,600 outsourced cost, a 64% reduction. Furthermore, the risk of workflow gaps disappears. Staffingly maintains trained backup staff, ensuring coverage even when your primary specialist is out. Logistically, the remote team works directly inside your practice's existing EHR system, and you can deploy them in 48 to 72 hours. There is a required operational shift. You can no longer rely on informal guesswork. Your practice has to strictly standardize its form completion protocols, so the remote team has exact rules to follow. Outsourcing slashes costs and ensures forms are always processed, provided practice leaders commit to clear, standardized workflows. Virtual specialists process forms faster and with greater accuracy than an overwhelmed in-house employee because they are backed by purpose-built technology. Document intelligence tools automatically read and categorize incoming paperwork, drastically speeding up how quickly a specialist can sort and process high volumes of forms. An active AI error prevention layer learns from historical mistakes to flag common omissions or coding issues before the forms are ever submitted. Practice managers monitor everything through real-time analytics dashboards, gaining instant visibility into processing speeds and error rates. Combining human specialists with AI eliminates the error-prone manual steps that contribute to the $125 billion lost to poor billing practices every year. Sticking with the status quo means accepting that a portion of that $125 billion industry loss will continue to drain your own practice's revenue. This scorecard outlines the ideal fit. Staffingly is built for mid-size practices that are currently fighting the 40% front desk turnover rate and managing high daily form volume. It is specifically designed for clinical directors who urgently need to reclaim those 8 to 12 lost hours each week and return them to direct patient care. If you run a micro-practice with a very low volume of prior authorizations and the cost of a single administrative hire hasn't broken your budget, this model might not be necessary yet. Decoupling form completion from your office is a targeted, strategic maneuver designed for growing practices actively losing revenue to scale-related bottlenecks. Your clinical staff spent years learning how to treat patients. You should stop paying them to push paper. Choosing to maintain the constant cycle of hiring and replacing in-house admin staff is an active decision to lose nearly $40,000 a year in unnecessary overhead per seat. To lower the barrier to entry, Staffingly offers a 2-week risk-free pilot to prove the concept, with absolutely no long-term contracts required. They have already successfully supported over 800 providers across all 50 states, working directly inside more than 100 different EHR systems. Stop the staffing spiral. Book a demo today to see the math for your own practice and get your clinical team back to doing what they do best.